Now 4:30 and welcome back to 11 Alive News at 4. Atlanta-based workers at the Centers for Disease Control, some of them at least, are getting nervous about the upcoming transition to a second Donald Trump administration.
11 Alive's Doug Richards is live at the CDC. And what do we mean by nervous, and how so, Doug?
Well, they got a playbook on how Donald Trump operates during his first term, and add to that the uncertainty of the appointment, or the nomination rather, of Robert Kennedy Jr. as the cabinet secretary that oversees health and human services. And you get an equation that results in some of these folks at the CDC wondering if they're really going to be employed during the second term.
There is definitely uncertainty. Employees are worried that they may be forced to retire early. And some just think that they may lose their jobs, period.
Yolanda Jacobs runs the local chapter of the American Federation of Government Employees. She says the union has been doing anonymous surveys of CDC employees in anticipation of a new contract. Donald Trump visited the CDC after the pandemic started. The survey of CDC employees reveals more than a little anxiety about Trump's second term and about his choice of Robert Kennedy Jr. to lead the Department of Health and Human Services, which oversees the CDC.
A lot of them call him anti-vaccine or an anti-vaxxer.
I'm not going to take away anybody's vaccines.
Kennedy told NBC after this month's election that COVID vaccines did not work as advertised.
They were saying, you need to take this vaccine in order to protect grandma. I knew in May of 2020 that the vaccines were not going to protect against transmission because I was actually reading the monkey studies then.
And Kennedy hinted that some top personnel may be on the chopping block if he oversees U.S. health services, including the CDC.
What starts at the top normally, flows down to the bottom. So, like I said, there is definitely uncertainty.
All right, Doug, so we've heard the union's perspective here. Are any CDC employees actually speaking out or giving their perspective?
Well, as you know, the CDC is chock full of scientists and other smart people with very sound survival instincts, and those two qualities are preventing them from saying a lot to people like me at this point.